Welcome to episode 92 of the Daniel Yoris podcast with today's guest, Dr. Jack Jeng. Let's go. Welcome back to the podcast, everybody. Joined here today by Dr. Jack Jeng. Jack, thanks for being here, man. I appreciate your time after this busy weekend that you've had.
Thanks for having me, Daniel. I'm really excited to be on your podcast today.
I appreciate you. I think this is a good place to start. I'm going to give you a second to introduce yourself, but you've moved over the weekend, which is busy. Sleep goes out of the window. If anyone's watching the video version of this podcast, I'm in like a dark room. I'm not in a cave. It's just daylight savings time happened, and now it's like getting dark earlier and sleep is affected. And that is something that really affects our overall well-being, and especially our testosterone. And I think that's something that I want to come back to, but I want to just kind of leave us hanging with that thought. Jack, tell us a little bit about what you do and who you are.
Sure. So my name is Dr. Jack Jeng. I'm a physician and also currently the Chief Medical Officer of Hormone Health. Hormone is an online men clinic focused on treating men with hormonal imbalance like low testosterone. We also more recently are offering solutions in the longevity space. We're looking at ways to increase health span and lifespan and prevent chronic diseases, and also help improve people energy levels. So that's a more recent offering that we've been doing, but we really built our business around treating men with hormonal imbalances like low testosterone. Prior to joining Hone, I went to the Mayo Clinic for medical school, did my residency training in San Francisco, was an attending physician at UCSF. I actually joined a startup when I was still practicing. I was doing it part-time as a chief medical officer, and the startup was focused on at-home diagnostics. That company grew really quickly during COVID. We were actually acquired by Becton Dickinson at the end of last year. So during that transition, I joined the acquiring company and met Saad, who is the CEO and co-founder of Hone, and really got interested in what he was building at Hone, and was really excited about sort of the more holistic approach Hone was taking to treating men. I think, it's pretty classic for men to not really want to talk about their health or think about their health. And we had a, funny joke at Mayo, which was, located in middle of farmland country, where if a male farmer came in because their wife forced them to, we didn't really need to do any more testing. We could just admit them to the hospital because something serious was going on. Because men really don't like to go to see their doctor, and farmers take that to the extreme. So when I joined Hone, I was really excited to see the community that Hone was building, really trying to destigmatize this topic, to have open and frank conversations about things like sexual dysfunction, erectile dysfunction, problems with their mood or libido. These are all things that I think a lot of guys don't feel comfortable talking about, and Hone was really working to make this a safe place to talk about and to think about.
It's something that we even see in fitness. There's just generally less males seek to hire a personal trainer because I don't need any help. I can just do it on my own, and then we get what we've got right now. But being on the preventative side of things, which I think is what Hone is more trying to be, and sort of early on, right? When you talk about sexual dysfunction or erectile dysfunction, that may not be the end of the world. It's certainly not a death sentence by any means, but it could be the beginnings of something else that's happening in a lifetime of poor lifestyle decisions. Is that correct to say?
Yeah, so I think that's one thing that is really important to get across, is that testosterone deficiency, which means that you have low testosterone, you have symptoms of low testosterone, is really a chronic health condition. Some of the common symptoms, like you mentioned, are problems with getting an erection and maintaining erection, and sexual dysfunction. But a lot of studies have shown that men with testosterone deficiency actually have higher all-cause mortality, higher risk of heart attacks and strokes, higher risk of obesity and metabolic syndrome, diabetes, poor bone health. So this isn't just a, am I performing in a bedroom kind of thing? Am I putting on muscles in a gym kind of thing? This is a serious, chronic medical problem that, if untreated, leads to worse outcomes. So it's so much more than just, kind of the surface level, what people think about when they think about someone with low testosterone. There's just been study after study showing that once you treat men with low testosterone, with testosterone deficiency, with testosterone therapy, their overall health outcomes just really improve. So it's something that we really are trying to get across and trying to talk more about, because I think it's something that has gone under recognized and underappreciated for a very long time.
I totally agree. And I think that in part, the fitness industry and maybe the bodybuilding world has been contributing to this in the sense that steroid use, or even just use of regular testosterone, has been abused many, many times. But we fail to differentiate, I think, as a society between the use and the abuse of a substance, right? Like, we tolerate the use of alcohol, having a couple glasses of wine, drinks with your friends, like, that's okay. The abuse of alcohol is obviously not okay, and we don't wish that upon anyone. But somehow the for testosterone went from like 0 to 100. It's either you're not using it or you're just a juice head, steroid injecting monster, and you're just a menace to society. And it's like, well, if you use it correctly, there are beneficial things that will happen, and the stuff that happens in the gym is almost the least exciting of those things.
Yeah, and that's a very important distinction. So Hone does not treat men with normal testosterone levels. So if you do not have a clinical diagnosis of a testosterone deficiency, so you do not have low testosterone or free testosterone, you do not have symptoms of low testosterone, we don't provide treatment. There are obviously, athletes and, like you mentioned, bodybuilders who are still going to gain some, benefits. But in our mind, the benefits that they're gaining don't outweigh the risks of taking testosterone. So not only do we choose the patients that we start testosterone therapy in very carefully by following medical guidelines, but once we start it, we also monitor people very closely for the side effects and adverse effects of being on testosterone. So while there's a lot of health benefits, there are also going to be risks involved when you're taking a medication like that. So we actually do quarterly lab tests and follow-up visits to monitor people's blood levels very closely, to look for signs of where we need to adjust the testosterone dose. The other important thing is also, anytime you look at a medication, the poison is the dose, right? If you give someone too much of something, you're going to increase the risk of having adverse effects of it. So we really want to make sure we provide the right dosage for the patient for what they need to start feeling better, and start gaining some of the health benefits, but without giving them too much where they start to have more and more of the side effects. Side effects from taking too much testosterone could be relatively mild, from having, acne, maybe some hair loss, to, much more serious, where your hematocrit, or your red blood cell level, gets to be too high, and you have some, effects from that. And I think there's also a risk of having sleeping problems. Sleep apnea can increase when you're on really high dose of testosterone. So there are things that we have to watch and monitor when someone is on testosterone therapy, which is something that Hone does really well. And, I think most people who are taking it recreationally for bodybuilding, they're not getting, lab tests every 3 months to monitor for these things. They're not under a careful guidance of a doctor who's looking for signs where, hey, this may actually start to become, dangerous, and we need to cut back on a dose or, switch things up.
This is the main difference between health and performance. I think it's been confused in many aspects, but especially in this, where performance doesn't necessarily equate to health. A bodybuilder who is already at normal or high levels of testosterone in their body, taking more doesn't make them healthier. It may make them perform better in their sport, and that's a decision for them to make, and kind of a separate issue. But the health benefits of someone who has low levels of testosterone is really what we're talking about, and what we're trying to get, and to make it more mainstream and acceptable. It's not, well, I guess it's not normal to have low testosterone, but you're not the only one. If
becoming
it is, right.
Well,
right.
That's actually a good point, because one thing that we've seen in more recent studies is just how prevalent this problem is becoming. So 20 years ago, my dad, when he was my age, had testosterone levels that were probably 20% higher than what mine are today. And, it's natural for your testosterone levels to decrease as you age. That's a totally normal phenomenon. And we typically see numbers like 1% to 0.5% drop per year starting at age 30. But what we haven't seen in the past that's becoming much more concerning today is a number of young men who are being diagnosed with testosterone deficiency because of low testosterone levels. And it's just something that don't have a complete explanation for. But we've seen this in study after study, and it's really it could be anywhere as high as 40%, depending on what cutoffs the study is using. But generally, it's around, the more recent studies have shown, around 40% of men age 40 to 45 or older have testosterone deficiency. That's a huge number. I mean, almost half the population of men in this age group are being diagnosed with clinical testosterone deficiency. And that's something that I think we all have to be really aware of, because the symptoms that we may start to experience, you may think, oh, this is just me getting older, when in fact, it actually could be a sign of something that's much more serious that needs to be addressed. And I think jumping to treatment is something that we try not to do as well, right? We like to start people off with lifestyle interventions, because you mentioned in the very beginning, sleep is a huge part of your testosterone. You can tank someone's testosterone levels by just depriving them of sleep for a couple of days. I mean, something that I did regularly as a resident, working those those 28-hour shifts. But sleep, your diet, and how much you exercise, those are all core components of men's testosterone levels. And for some men, that's what we start with. We say, you're really not doing good in those three domains. Let's start there. Weight loss is a big part of it too, because we know that, fat cells convert testosterone into estrogen. So the more fat that you have, the more you're going to convert your testosterone, which reduces your levels into estrogen. So we try to target those things first. But, for some men, they feel so bad because of their low testosterone levels, they can't even think about exercising. I mean, when you can barely get out of bed because you're so tired, and you have, brain fog and really poor mood and concentration because of your testosterone deficiency. It's kind of a chicken or egg problem. How do you get this person feeling better and healthier? Sometimes we start with treatment so they can get into a better place, so they can actually start to do the things that they know they need to do. But sometimes we start with the lifestyle interventions, but those are all linked very closely with this condition, and why it's so important to talk about these things is because I think a lot of men just don't even recognize that their symptoms are coming from that. They think it's just a function of old age.
I apologize to anybody who thought that Jack was going to say you don't have to exercise or eat healthy or sleep for a full night's sleep every night and you can just take a magic pill. Turns out that's that's still not the case. There are things that can help, but you still got to do those things. Not yet. But you read my mind by making that chicken and egg analogy there. I was just about to ask whether there are some cases where testosterone is so low and then that also causes so much weight gain, lack of motivation, lack of discipline, lack of just willingness to get up and make a change, that in some of those people where they could make drastic changes by making some quote unquote simple lifestyle changes, would starting with treatment be the first option? And I guess this is where kind of the individual approach comes in. And in an ideal scenario, the patient, gets the lifestyle changes or starts to make these lifestyle changes first, and then you introduce treatment. But in some scenarios, that's just not the best way to approach it. Would that be kind of correct to say?
Yeah, I agree with that. And that's why it's not something that we could just have a robot, say you do this, and there's some cookie cutter formula. That's why every patient that we treat starts with a 30-minute telemedicine consult with one of our affiliated doctors, and they're going through a lot of these things, and they're kind of figuring out what's the best approach for personalizing this care to you. And like you said, there are some people who say, hey, let me try these things. They may even try some over-the-counter supplements that are shown to increase your testosterone levels before they go to something like testosterone therapy. And I think that's extremely important because everyone has different goals in life. I'll give you an example. Once you start on testosterone therapy, your body may stop producing what little testosterone it was producing, which can also decrease your sperm count. So if you're a person who's actively trying to conceive with your partner, testosterone therapy, replacement therapy may not be the right option for you. So then we have to think about what are some other ways to help improve your testosterone levels and help you feeling better while still maintaining your fertility status. So again, these are all things that you discuss, our customers discuss with their doctor when they're having that 30-minute telemedicine consult. And I think it's also important to remember that people's lives change. So as you're making improvements, we're measuring your blood levels in that first year of treatment. We're measuring it every 3 months. So we can adjust the dosage. And to me, a success story would be someone who can actually even come off of it because they make all the necessary lifestyle changes. Unfortunately, for a lot of for a lot of men, even with doing everything right, they still have this condition. And that's where it's less behavioral and less lifestyle related and more related to genetics, possibly environmental factors. You know, we're exposed to much more pollution and chemicals today than we ever were. Just think about the amount of plastics that we drink and eat every day. And a lot of those plastics actually resemble estrogen. So our body can't tell the difference. And for sure, there's going to be an impact with that on our hormone levels. And I think you're seeing that more and more. We're seeing, even at a very young age, you know, for example, young girls are starting to have their, you know, menstrual cycles earlier and earlier. And we're seeing kids enter into puberty earlier. Again, I do think this is not purely just a, you know, genetic thing. I think there is a big environmental component that we're just starting to get our hands around.
Assuming that the environment was ideal and someone had their lifestyle factors in check, sleep, exercise, nutrition, etc., what are some of the reasons or conditions that would exist for a person that would, again, assuming all these things are in check, they would still have low testosterone? Or is that just extremely unlikely?
So I would say there are some other causes that, other conditions that can lead to low testosterone that we have to think about. So you can have a testicular problem. So if your testicles aren't producing testosterone because of you know, past trauma, or some sort of medical problem. So we'll see that. You can also have a problem with the brain, which produces hormones to tell your body to produce more testosterone. So you can have a pituitary or hypothalamus problem. These are all things that we're screening for in our visits with our customers. We do additional lab testing to look for things like that. And sometimes you have to actually go see someone in person to do, you know, advanced imaging, like an MRI of the brain, to look for any signs of, you know, potentially a tumor or a mass in the brain that's causing your body not to produce the hormones that leads to low testosterone. So there are some other health conditions that can lead to low testosterone. I would say it's at least with the customers that we see, it's pretty rare for us to find one of those things that are causing the low testosterone. More often than not, we don't have a clear answer why this person is suffering from it. And that's, you know, that's unfortunately just the state of things. I think if you look at Saad, our CEO and co-founder, his story is a perfect example of this. He was 35 when he started having some symptoms of low testosterone. And he's someone who is probably similar to you, very health conscious, worked out multiple times a week, slept well, really into health and wellness. And when he started having these symptoms of low testosterone, he started seeing doctors, and it took maybe about 6 months for him to multiple lab tests, multiple doctors, before someone finally told him, you know, your testosterone levels are extremely low for a man your age. Previous doctors kind of told him, hey, this is just old age. But his testosterone level was, I think, 180, which is not normal for a 35-year-old. You know, that's probably normal for someone who's 80, not a healthy 35-year-old. And Saad was in great shape, was already doing everything else right. So unfortunately for him, he has this condition. Now, he does live in New York City, so, you know, he is probably exposed to more pollution than a lot of other Americans are. But that's the only factor I can really think of that risk factor he has for low testosterone. And unfortunately, as we've, with our patient population, we're seeing this is becoming more and more common. The prevalence of young, healthy men being diagnosed with testosterone deficiency, it just is becoming more and more common. And I think it's something that we really, really need to be aware of, because not only do you have those symptoms, but you're also less, your sperm production goes down when you have low testosterone. So we've seen this trend too, in the last couple of decades, where our sperm levels are half of what they were just from our father or grandfather's generation. It's really kind of a scary thing, I think, that we're kind of not really spending a lot of time talking about. Makes you wonder what's going to happen with the generation after us in terms of fertility levels. So, yeah.
No, well said. And it is a scary thing to think about. We're always fighting against our environment these days. I've said this several times on the podcast, but like, my job as a personal trainer exists because of this built environment that we have. Hundreds of years ago, people weren't overweight and they didn't have like the inability to do a squat. This was just normal human function. But now we've lost that due to all this built environment. And of course, we've gained lots of good things through that, but there's been some trade-offs, and obesity is one of them for sure. We have such easy access to very high calorie foods that obesity is massively prevalent. And that's obvious because we can see it and feel it and it's tangible. But the testosterone issue is not nearly as tangible. And like we started this podcast by talking about, it's kept quiet by a lot of people. And we might notice some things are off, and you're told by your doctor that, yeah, it's just old age. But 35 is not old. It shouldn't be an old man. With all modern medicine and longevity science, like we should be living to 100. I don't think that that's a crazy thing to say. But it's unfortunate because it's not really seen. One thing that I did want to ask you about with the risk factors is there any evidence suggesting that head injuries, concussions lead to disturbances in testosterone production? Because that's something that I've heard about, never seen like conclusive evidence. But I live in Canada, lots of hockey players, football players in the US and whatnot, young kids having these mildly traumatic head injuries. Does that lead to something more sinister later on in the testosterone department?
So I'm not personally aware of any studies that looked at sports injuries linking to low testosterone, but there have been some studies looking at active duty or veterans who have served in the military who have been exposed to head trauma from combat, and there is evidence that the trauma they suffered can lead to lower levels of testosterone. Now, it's hard to isolate it to only that event, because you can also say our veterans and our active duty service people also have a lot of other factors like chronic stress from being in a combat zone, poor sleep, their diet's not optimal as well. Those are also things that could lead to low testosterone. So it's hard to say you can't really do a randomized controlled trial to show that. But I think from a biological standpoint, it's not hard to imagine how injury to the brain, to the pituitary gland, could lead to problems downstream, including low testosterone. So I think that while it's not something that's been, that I'm aware of that's been shown in a study, I wouldn't be surprised if people who have suffered multiple head traumas from playing sports can be affected.
Right. So it sounds like to me that trying to get down to the nitty-gritty of what is causing this widespread low testosterone, or to an individual who's listening, like what is causing your low testosterone, is almost, assuming you've got your lifestyle factors in check, your sleep, your exercise, your nutrition, it's almost useless, because you're not going to change your entire environment unless you want to just buy a house in the mountains and like go live on your own and have, erase all the trauma from your childhood. But aside from that, we can't really isolate it. So it's almost a useless endeavor. And so the only thing next to look to is, well, how do I fix this and how do I make it better? Is that fair to say? Or am I being a little bit too extreme?
No, I mean, I that's kind of how I view it. When sometimes, people ask like, why is this happening to me? And I think it's just like any other chronic health issue, is there are obviously going to be some, environmental and lifestyle related reasons for having these things and putting at risk for having it. But a lot of times it could just be bad luck, and you happen to draw the card that led to having this problem. And rather than focusing on that, we focus on, how do we get you starting to feel better? How do we get you to becoming having a healthy normal physiologic level of testosterone, so you can get back to doing what you want to do? Whether it's being a husband or a father. It's wild how many of our patients I've talked to who've just the stories they tell about how they just were not being a good husband or father or partner, how this low testosterone has impacted every aspect of their life. And since they started treatment, they've been able to get back to just being who they were, and being the person that their family, rely upon and has, basically been waiting for. I mean, it's actually kind of sad, but a lot of our customers come to us because of their partners saying, you need to go get this checked out because you're not who you are. Something's not working right. And it's kind of like that story I told you at the beginning about the male farmer that comes in. They often come in not because of their choosing. They're coming in because their wife or partner is telling them they better go in. And so that's not uncommon to see that with our patient population too. Is oftentimes it's their family members saying, hey, something's not right. You need to get this checked out. And then they come to us and they do the blood test and they see the doctor and they're diagnosed. And a lot of them tell, sometimes it's a kind of a gradual thing, right? So it's not like you wake up one morning and you have all the symptoms of low testosterone. It's often a gradual process as your levels drop, as you age. And people don't realize how bad they were feeling until they start feeling normal again. And that's I think what I love about what Hone is doing, is that we've had so many success stories of people who've been able to really just get back to being who they are and feeling their best. That is just so great. And I think as a doctor, we're so used to treating people, especially people at their end of their lives. We spend a ton of resources on helping people live a couple more days, a couple more weeks, and we spend so much of our healthcare dollars there, and we don't spend enough on people when they're in the prime of their life, in their 30s and 40s and 50s, like feeling their best and being their best. And again, I do think because of all the downstream consequences of low testosterone, by treating people earlier and addressing this hormonal issue earlier, we're going to see a lot of benefits downstream, because people who are treated just have way better health outcomes. So we mentioned some of the things like bone health, metabolic health. It just, there's the amount of data is showing that the benefits that come with it. I just think that we haven't spent enough of our healthcare dollars where it really needs to be, which is now for before people develop all these chronic medical problems.
It's a huge trickle-down effect. I think an easy one just to pinpoint is if supplementing or using testosterone therapy rid the world or rid men of diabetes to a high degree, then that would be huge savings in the medical care system. And obviously very different here in Canada than in the US. But if we helped people just manage their weight and maintain a little bit more muscle mass, and that led to a massive, 99% increase in diabetes, and I'm not saying that it's that drastic, but let's just imagine that it did, then what would the healthcare cost savings of that be to the entire system? It would be astronomical, right? For something that is pretty simple and is going to lead to a whole host of other health benefits that are not tangible and not countable by public healthcare spending, like being a better partner, being a better father, being able to show up in your business, in your community, and all of these things. So thinking about this more holistically is certainly something that I agree with that we need to do, and not just about, okay, well, the cost of seeing the doctor is this much and the cost per month for your testosterone medication is this much. It's like, well, yeah, but what about the cost of you being sick for the next 60 years of your life? Like, that's not something to just forget about and pretend it doesn't exist, whether it's coming out of your pocket or it's coming out of the government's pocket, like, which is basically your pocket for people who don't make that connection. You're still paying somehow. So you might as well do the thing that's going to make you feel better. One thing that I wanted to
exactly, and that's I was going to say one thing. This is why we're so excited about some of the other things that we're working on with longevity. So we're starting now to look at what are some of the scientifically backed therapeutics that have been shown to improve health span and lifespan. And so these are things like low dose metformin, NAD plus, glutathione, vitamin B12. These are all things that have solid evidence of showing benefits to people's longevity, which we think is very exciting. And there's also, I think, going to be in the next 5-10 years, given the amount of interest in this space, more and more therapeutic options to improve longevity. And I'm very excited about that, basically to a lot of what you were talking about, which is what are the downstream benefits on our healthcare system, on our government spending, and delaying the onset of chronic diseases, helping people live longer and stay productive members of society longer. If you think about just how much time and resources are spent on taking care of elderly people, I think about my grandparents, who my parents are now taking care of. If they could just live a few more years of healthy life without needing, around the clock care, that not only allows them to do what they love to do, but also for their family members to be able to continue working and doing things that they love as well. So there are just so many downstream benefits, which is why I'm very excited. Testosterone is a great example of this, but there are other therapeutics out there that have high efficacy data showing, like metformin, I think is a great example. And I'm really excited about the amount of investment that's going into the space. I was recently at a longevity conference, and there are just so many really smart scientists who are studying this, working on different small molecules that have been shown in preclinical studies to have these benefits, and now they're moving into larger clinical studies. I wish we would spend more money on this area rather than spending so much money on treating people only when they're sick. I think that as a doctor, we're so used to seeing providing care for disease rather than keeping people healthy and preventing them from developing disease in the first place. So this is an area of what we're working on at home that I'm extremely excited about.
It's a shift of the entire medical system working towards prevention and away from a sole focus on healing after the fact, right? Of course, there's still going to be things that happen. You're still going to break your arm. You can't just, preventative yourself away from from breaking your arm. That's going to happen. We still need those things. There's going to be crazy accidents and illnesses and, diseases and stuff that comes up. We still need that. But working on the prevention side of things, I've been saying for a while as well, it's like this is where we need to be spending resources and shifting the paradigm. The other side of it is that it does take some work from the person. Doctors in the system, quote unquote, is not going to seek you out and tell you that, hey, you need to be doing X, Y, and Z, and maybe you should get these things tested, and maybe consider take this, that, and the other thing. You do currently have to take the onus on yourself to go and seek out this help. So on that note, what are some of the things that people should be looking out for to then go ask their doctor to get certain tests? And just to, go back a second for what you said earlier, is that this is not you wake up and all of a sudden you're feeling bad. There's a gradual onset to this. So it's not going to be that obvious to be like, okay, I woke up and I have a stuffy nose today. It must mean I have X. It's not like that. So what are the things that people should be looking out for and then go ask their doctor about?
Yeah, so there's obviously the classic symptoms of testosterone deficiency or low testosterone that people should be aware of. So these are things like erectile dysfunction, low libido, poor mood and concentration. People may be noticing that they're putting on more abdominal fat and less muscle, and maybe have poor sleep. There can also, in some cases, people can actually develop depression from it. That improves once you start treating them. Those are kind of the more common symptoms of low testosterone. But I tell people that even if you're feeling great, there's no reason why you can't get tested and to know what level that you're at. Because once you start feeling bad, then you kind of know what's a good target for you, because everyone has a different optimal level of what their testosterone should be. So for maybe me, a testosterone level 500, which might be low for some people, is actually perfectly fine for my physiologic, need for testosterone. Your androgen receptors are going to be different in terms of its sensitivity. But 500 for you might be just too low, and maybe you need an 800 level to really feel at your best. So there's no reason why you can't get tested on a regular basis. I think it is something that I wish was part of our regular annual physical screening tests that people do, because I think it's something that is underappreciated and underrecognized now. But for sure, if you're having those symptoms that I mentioned earlier, those are all reasons why you should go and get this evaluated. But even if you're feeling well, there's no reason not to test.
Right. And when you do, what are the tests that you should be asking your doctor for? It's very different here in Canada. Like, I've had my testosterone levels and stuff checked like once a while ago, but I basically had to lie to my doctor in order to get him to like allow me to pay for the tests to take them. It was like a whole ordeal, and I was like, whatever. But what are the things that you should, like, don't do that, don't take my advice, blah, blah. But what are the things that you should be asking for?
Yeah, so I think one thing to recognize is that testosterone exists in two forms in your body. So you have your bound testosterone and your free testosterone. The free testosterone is actually what your body's using, your cells are using. And then the bound testosterone is bound to different proteins like albumin or SHBG, sex hormone binding globulin. This is what your body uses to transport testosterone from one area to another. So you have to measure both in order to get a good idea of your testosterone status, because some people can actually have a relatively normal or low normal testosterone, total testosterone, but their free testosterone is very low because maybe their SHBG is elevated, and they're still going to have the symptoms of low testosterone in those situations. The other thing that we check as part of our initial test is estrogen or estradiol, which is a form of estrogen, because oftentimes we see that some men, especially men with excess adipose tissue or they're overweight, they're converting a lot of their existing testosterone to estrogen, and so they're going to have some symptoms of too much estrogen, like gynecomastia, or I think people call man boobs. They might have sensitive nipples. These are some signs of having too much estrogen, and too much estrogen on its own can also cause some of the sexual dysfunction, erectile dysfunction issues too. And it's not to say that you don't want to have any estrogen. You actually you need estrogen to function, right? Men don't need as much as women do, but we still need estrogen. So for things like our sexual health, our bone health, you need a certain level of estrogen to function, which is why we check it at the initial test, and also each time we're doing the follow-up labs, we also check it. And there are ways to reduce estrogen on its own. You can use what we call aromatase inhibitors, like anastrozole, for example, which is something that we commonly prescribe. Our doctors that we work with commonly prescribe to our customers to help lower people with excess estrogen levels down to a healthy level. We also do some other tests at the beginning just to also screen for, as I mentioned, reasons why you may have low testosterone. That's not something that we necessarily, or there are things that we may want to address before. So a great example is a pituitary tumor, which can cause you to have low testosterone. So once that tumor is removed, then your testosterone level should recover. So there's really, you shouldn't necessarily start treatment in those patients. They should really be referred to a specialist to have that tumor evaluated and taken care of. So we're going to be measuring things that could be an indicator that is what's happening. We also check liver function tests to make sure that the liver is healthy, because the medications that we prescribe are metabolized in the liver, and we don't want to put people at risk if they're if they have some liver disease that's been undiagnosed or they're not aware of. So these are a number of other biomarkers that we're checking with our tests. But I would say the big ones for hormonal health are the estrogen and testosterone levels. Something that we're not currently testing, but we're working on adding to our panels in the future are, thyroid panels, because oftentimes that has overlapping symptoms. When people have a underactive thyroid, they may have the symptoms of fatigue and low energy, and poor concentration. So those are, biomarkers that I think people should also consider if they're having those kind of symptoms. And it's something that we're working on offering in our future panels as well.
And so someone who is a patient of Hone can, sign up or contact the company and you will order those tests. Is that how it would work? I assume that it's not available to Canadians, but if you're in the US, you can contact Hone. Hone will order those tests for you, so you don't have to remember all of those things that you just mentioned.
That's right. Yeah, we are we service 35 states in the U.S., so not all 50 states. Some states we don't currently serve because of telemedicine rules and regulation. But we're working to expand to every state that we can. But right now we're currently available in 35 states. And patients basically come to us and say, "Hey, I'm having these symptoms of low testosterone," and our doctor can order them an at-home test. So it's a finger prick blood test. We're also working on offering that initial test to be done at LabCorp, and you can get tested that way to start the process. And then once the results are back, schedule a telemedicine consult with one of our affiliated doctors to review the results and talk about what the next steps are. And again, not everybody that tests with us actually have low testosterone, and we can see that in the lab values. So the doctors are also evaluating them for other reasons for their symptoms. And sometimes we may actually have to refer patients back to an endocrinologist or urologist. But generally, I would say that a lot of the people that come to us that are diagnosed with testosterone deficiency, we are able to safely treat them using telemedicine. And we don't necessarily have to see them in person to be able to do a physical exam, which is what I think one of the exciting things about making this type of care more accessible. I would say, prior to COVID, people would probably, have some experience with telemedicine in the U.S., but it was much more limited, more to, maybe someone that has a sore throat or, an upper respiratory infection or a UTI or something. But now, since COVID started, a lot more people have considered using telemedicine, and we've been able to start to treat really, chronic diseases like testosterone deficiency effectively virtually, being able to test them from home or have, refer them to a LabCorp in their area, being able to see them for the scheduled consults, in our case, every 3 months, being able to adjust their medications and have the medication shipped directly to their home. These are all things that make this type of care much more accessible. And I love it when I talk to one of our customers who happens to live in an area which they don't have access to medical services very easily. They live in a very rural part of the country, and it's a 2-hour drive for them to see their doctor or to get a lab draw. And so what we provide to them is just something that is so much more convenient and accessible. And we do it at a price point that is that's much more affordable for a lot of people too. Right now, we're currently cash pay, so we're not working with insurance companies, but we're actually in the process of working with insurance in a couple states. And if that goes well, then we would be able to start expanding to accept insurance in all states that we serve. And I think that would be really exciting because when we can even bring the cost of care even further down.
It's always,
it's one of those. Sorry, go ahead.
I was going to say, it's always disappointing when finances get in the way of medicine, this is just the way the world works. And it's part of how things go. But getting insurance companies on board with the fact that this is a viable and very helpful preventative treatment form is actually a huge difference maker. And it sucks that the world is that way because money has to trade hands for things to happen. But once those insurance companies get on board, then that opens it up to so many more people. And this whole holistic approach of all of the things that you guys are testing for really just speaks to how complex of an issue the low testosterone issue is, that it's not very simple. And there's so many things that could be leading to this and causing this. And it's not really clear as to why or how or when or who. It's just all over the place. And so there's so many things to check. But I was just going to say, it's disappointing that money always gets in the way, but this is just a reality of life and the way the world works.
Yeah, I would say that's one of the most frustrating things about practicing medicine is how much the finances and the economics of something matter. And, obviously we're not providing charity care here. Like we have to be able to, pay our doctors and our staff and pay for the medication, those kind of things. But it really kills me every time when someone forgoes getting something that we know they need and it's going to help them because of finances. And I think the one thing about testosterone therapy, at least, is that we know the downstream effects are so beneficial that while there may be some upfront costs for treating low testosterone, because of the downstream effects, it's a net positive in the end. So not only are you helping someone feel better and helping them have better health, but even from an economics standpoint, there's going to be benefits at the end. And I do think that, at least in the US, I do think that insurance companies are thinking more and more about the, long-term economics of treatment. That's why there's been more focus on preventive care, on primary care. That's why you're starting to see more value-based care. And I think those are all, heading the right direction. Having been, working in the healthcare space for a while now, it's like turning a big ship. It just, takes time to make any, changes. And I think a lot of, patients and doctors, they're not paid, it's sometimes feels like, things just aren't moving fast enough. But you're starting to see those kind of signs of those things that are starting to come into play. And I'm very optimistic that in the future, treatments like what we're providing at Hone are going to be things that are going to be covered. And I think it's going to open it up to so many more people that really need this type of care. And right now, even though we're cash pay, we're still a very affordable option. We have a lot of people who are, not necessarily people you would think just has a bunch of money to throw away on something like this, but because of how much of a benefit they see, this is something they actually prioritize. And this is something that they know that has such a benefit on all aspects of their lives that it's worth putting that money towards. So we obviously have to do our part and try to work on bringing the costs down and working with insurance companies to bring the costs down. But it's still really, I think a service that is more affordable than a lot of other things that we are part of the healthcare system today, because we're doing a lot of things virtually and not have the same kind of overhead of maintaining brick and mortar practices.
It's that whole cost accounting approach again, right? When you add everything up and the potential things that you're saving down the line, like spending a little bit now does go a long way. I think another advantage of the telemedicine thing is, again, going back to your farmer example, that it's a lot lower barrier to actually seek help. You're logging into a video chat of some sort rather than going out into a doctor's office where, the fear of some neighbor might see you and like what people are going to say. And while that's completely wrong, but like that's a real thought that people have. So I think the telemedicine aspect is a great avenue for this type of treatment.
100%. And during COVID too, you didn't want to leave your house because you weren't sure if you're going to get infected and get sick from the disease. And so there's that aspect to it. And I think it's just one thing that is underappreciated by me as a doctor was the amount of logistics for someone to get to a doctor's appointment. They have to potentially take time off work, find childcare. If they don't have a reliable means of transportation, maybe take multiple buses to even get there. I mean, there's just so many things that contribute to getting care, in-person care that telemedicine addresses. And I just didn't really appreciate that as a practicing doctor. For me, it was just like, oh, this patient's late. Like, what's going on, right? It's like, it's inconvenient for my schedule. I'm trying to see all my patients in a row, and this person's late. But I'm not appreciating that, hey, maybe this person's babysitter canceled on them. Their bus was delayed, their train, whatever it is, right? That impacts their ability to even get there in the first place. And oftentimes it's our most, at-risk population, the ones who are coming from lower socioeconomic status that that these affect the most. And that's why I think virtual care is something that is really so incredible, because we're able to work around their schedules much better. as a doctor, most people have that experience of, getting there on time and waiting an hour in a waiting room because their doctor's late. Well, it's much easier to wait around in your home when you have, everything with, all your stuff, your toys around you, than it's to wait in a waiting room where, you have bad music and some magazines. Um, and so, and another thing, I really love about telemedicine is that, you're able to actually see people in their normal state because they're in their home. You're able to, say, hey, show me your fridge. What's in your fridge? Let me see what kind of food you have in your pantry. You're able to meet their loved ones. You're able to meet their pets. You just get to see so much more of a person's life than having them in a gown sitting on your exam table, which is a very unusual state to be in. And so we talk about, people who have what we call white coat syndrome because their blood pressure is elevated when they come to the doctor. But it's just one of those things where I feel like the more I can get the patient closer to what they're like in their everyday lives, the better, the more accurate of a picture I'm getting of their health. And so I really do think telemedicine is really, a wonderful technological advancement. There's always limitations to everything that we do. So, I can't do a physical exam the same way I could if you were sitting in front of me. So, there are going to be times where I have to refer people out to have that prostate exam performed, or have that physical exam performed. But, I don't know what the exact percentage, but maybe 80% of what we're doing, we're fine with doing everything virtually, right? And it's only that small percentage that needs the in-person kind of care. And not every specialty is going to obviously be able to do things virtually. I was a practicing anesthesiologist prior to joining Hone. I can't deliver anesthesia care, through a Zoom call, nor would I want to try to do that. But a lot of specialties, even my surgical colleagues during COVID, they had never done telemedicine before, but they told me, well, during COVID, I kind of had to. And yeah, so I still had to see people, in my clinic to remove the stitches and, examine the wound. But I was able to replace a lot of the follow-up visits where maybe it was just a 5-minute check-in to see, hey, how are you doing? How are you, just a quick check-in. And for some of their patients who have to travel hours for that 5-minute visit, it's so much more convenient for them to just do it virtually. So even specialties like surgery are starting to realize that, hey, virtual medicine is a great complement to what I do. So that's an area that, Hone obviously built our practice and our model from, around virtual medicine, and we wouldn't be able to exist without it. But it's also exciting to see that even more traditional healthcare systems, like the academic hospitals I used to work at, are starting to really embrace and adopt telemedicine, and I think that's better for the patients, which is the most important thing, but also for doctors. They're able to, like I said, gain some benefits from seeing people in their natural habitat.
Yeah, and I think the other side of it, just to be very real, is it keeps some costs down and keeps efficiency a little bit higher. Less time between patients, don't have to clean the room, don't need as many rooms, so there's less costs, and therefore those costs can be allocated to patients and treatment and research and whatever other things that the healthcare system needs to spend on. I have a question for you that I'm okay if you don't answer it, but this is coming from the conspiracy theory side of my brain. Have you guys, or have you experienced any pushback from insurance companies, from pharmaceutical companies, manufacturing companies, in the sense that, okay, if everyone started using this therapy, there'd be all this downstream positive effect, and therefore people would be not using other medications or accessing other services that generate millions and billions of dollars. Is that something that you've experienced? Is that something that you anticipate experiencing? Or feel free to leave that one alone.
I have not experienced it. And to be honest, I have a hard time imagining that we can coordinate something that effective, where there's enough people involved that they can actually manage to successfully pull something like that off. The truth is most companies and politicians and, governments they're just trying to keep the lights on most of the time. It's these kind of master plan things, I think, are, to me, very unlikely to have, and seeing how, complicated it is to even do the basic tasks, right? But I would say I haven't seen this personally. I think most people that work in healthcare are people that care about helping people, feel better, be better. And of course, there's always going to be some examples against that. But by and far, I would say people that I meet that work in healthcare, they care about helping people. And that's the reason they chose to go into healthcare. You don't go into healthcare if you want to become rich, because that's not the path to become rich, right? And so I think it's just, yeah, very, to me, very unlikely that you're going to have some kind of grand conspiracy, someone who's masterminding this kind of thing. I think most of the time the resistance we hit is probably just more from sort of inertia, and this is how things have been done for so long, and changing is always hard. And I think that's really the biggest barrier that we hit, is often just helping people recognize that, hey, things have changed. The prevalence of this condition has increased dramatically in the last couple decades, and we need to really start to invest some resource into it. And so it's just going to take some time to get there. At my previous startup, we were working on chronic kidney disease, and that was another one where a lot of insurance companies were like, hey, this is great if we can make screening and testing for it more accessible, but we're not really the ones paying for dialysis care, because that's usually when patients are older and they're already on Medicare, so the government's paying for that. We're not really the ones paying for it, so we don't really know if we want to pay for tests now that may prevent people going dialysis later, because this is cost to us today. And so we did encounter some of that kind of thinking, where they looked at the numbers and said it just didn't make sense. But even there, because there were some changes with quality metrics and how insurance companies were evaluated, within just a few years, the insurance companies executives are telling us that, hey, I know we told you before that we weren't interested in paying for this. Well, we are now, because now these quality metrics are tied to our ability to do the type of chronic kidney disease screening that you guys are pushing for, and that your test will make more accessible. And so again, maybe sometimes it does take a little kick in the butt, but to me, the biggest barrier for us has really just been the inertia of how things have been done and always been done, and not really recognizing that things change over time, and conditions like testosterone deficiency has only continued to go up over the last couple of decades, and we need to really recognize that because of all the downstream effects.
Yeah, good to hear. Kind of the answer that I expected and was hoping for, but I'm happy to hear. You hear crazy things, and with the kidney example, like I understand that as well from that insurance company's point of view. If they're being asked to invest a significant amount of money in a company that doesn't give them any financial kickback or any gain, then if they cease to exist, then they can no longer provide their helpful service to everybody else. So again, it's just this sad reality of the way things are, and everyone can't just pay for everything and get nothing in return. It's just impossible. But yeah, we know, I think that most people are in this to help people. It, like you said, medicine, fitness, not the industry to go into if you want to get rich. Sure, there's lots of money to be made, but there are easier ways to make money than telling people to stop eating cookies and go to the gym and work out a little bit. So
yeah, but I think ultimately what it comes down to is that the best advocate for your health is yourself, right? So educating yourself, listening to podcasts like yours to gain the kind of awareness and knowledge, so you can start to really be your best advocate. I actually think that's the most important takeaway, and that's something that I think the internet has really revolutionized. It's just access to information, and people can go on and find that kind of information and talk to others in similar situations. So one of the things that we do at Hone is we actually have a pretty robust community. So our current customers, actually, they post about their own experiences, and they're often a better resource for new customers than I am, because to be honest, I've actually never taken testosterone. So I've never gone through that experience of injecting myself once or twice a week. And what are the things that come along with that? Maybe I'm scared of needles. And it's really great to see someone who's maybe a Hone customer who's been with Hone for a couple of years say, hey, yeah, don't worry. This is how I pinch my, my skin when I'm doing the injection. And this is what you should, expect. And as a doctor, we can talk about these things, but sometimes hearing it from someone who's gone through the exact same, gone through that experience, it's just so much more powerful. It's actually one of the things that I love about our company is that not only is Saad, our CEO and co-founder, a patient, but quite a few of our executives actually are also people who are on testosterone replacement therapy. And they all have their own stories, their own journeys of how they were diagnosed and how they started treatment. But they, these are the leaders of our company. And so they know the customer's pain point really, really well because they are customers. So they know how hard it is sometimes to just get, needles that they like, and, and what do they do when they're traveling overseas and you need to bring a stash of, needles and medications. So, like, they know these things because they live it. And that's something that I really love about working at Hone, is being able to work with people who are patients themselves. And again, one thing that I think that I can't stress enough is just being the best advocate for your own health, because no one's going to care about your health as much as you. I promise you that. And so I think people like yourself doing such a great service, getting the kind of awareness out there and knowledge out there, so people can take the appropriate steps. And I think a lot of those things will follow, because again, with testosterone, treating testosterone deficiency, it's a net benefit. There's just so many downstream benefits that come with it, that it's really a no-brainer to me for us to be screening and diagnosing people with this condition and treating them when it's appropriate, because there's just so many benefits that come with it.
Totally agree that everyone has to be is the biggest advocate of their own health, because like you said, nobody will ever care about your health more than you do. Something I say, like with my clients in the gym, is like, okay, well, for a stretch, this is actually a good example of like, okay, get into this position, like do this, pull that stretch, and then find the position that feels good to you, because you can feel yourself better than I can see what's happening in your body. And the same is true for these things. So, someone else might see that you look a little bit tired or look a little bit down or whatever the case is, but you can feel what's happening to you better than anyone else can see what's happening to you. So you have to stand up for yourself and be the biggest advocate. And I think the access to information online through this podcast and through every other channel is good. Also comes with some downsides of like poor information and conflicting information, obviously. But this is where just critical thinking comes in, and you have these different pieces of information, and then go to someone who you trust, your doctor or whoever, and ask the question, because you're allowed to ask the question and challenge people. I encourage people to challenge me. If I say something that's like, oh, this guy's off his rocker, challenge me and I'll give a justification, and maybe I'm wrong. But, you have to be the advocate for yourself. Don't just take what I say because I said it. I don't know everything, and neither does anybody else. So you've got to really stand up for yourself.
Yeah, and I can't tell you how many of our patients who have spent months to years, seeing multiple doctors before finally coming to Hone and seeing one of our physicians and getting the diagnosis. It's just one of those things where if they just took the first doctor they saw and said, okay, I'm just getting old and I just got to learn to live with it, and they stopped pushing and looking for answers, they never would have gone on treatment. So it's one of those things where, again, you just have to be your best advocate. And if something doesn't seem right to you, because you know your body better than anybody else, keep pushing, keep searching for answers. And, our, Saad, perfect example. He went to multiple doctors over many months, multiple blood tests before he finally found someone who knew who knew about testosterone deficiency, knew about hormone imbalances, and got him on treatment. And so, hopefully people who are listening to this are not going to be in that position where, where they're not getting their testosterone levels checked when they're starting to have these symptoms. But yeah, tell your friends, it's funny because I have a group chat with my buddies from high school. And when I joined Hone, we all started talking about, what Hone does, and everyone started sharing their own stories and how they were actually tested for low testosterone because they were having, XYZ symptoms, whatever it is. And it was just really cool to actually have those kind of like open conversations about our health, which is not a typical thing I would say, a group of 6 guys on a text thread are normally talking about. But it was really cool. I think that was one of the things I really loved about what we were doing at Hone and really building that community, is just having people be there for each other to talk about these things, and help people feel like they're not alone in this journey. it's one of those things. I remember meeting one of our customers who told me that before he before he got became a customer of Hone and got on therapy, he was a father, husband. He would have to make up excuses to his wife, at night, say, hey, I have a headache or I'm not feeling well because he couldn't get an erection. I mean, it was so sad to just, think about being in that position where you have to lie to your loved one because of a health problem and not even, knowing what's going on, not even realizing that, hey, this is actually a symptom of a much larger problem and once he got on treatment, he's like, I felt like I could be a husband and father again. And it's just one of those things that was such a powerful, story to me was just the kind of like transformation that, treatment like this can have. And I just wish that it was something that was talked about much more openly. And I would say, it's not just something that patients need to be aware of. It's actually doctors as well. I actually never learned about testosterone deficiency in medical school. So it wasn't something that was covered as part of our core medical curricula. And I hope that begins to change because now that we're recognizing how prevalent of an issue it is something that I think that doctors of all specialties need to be aware of. Because, even if you're a psychiatrist, you may see someone come into your clinic with some of these symptoms and you're only thinking about mental illnesses and not thinking about, hey, is their hormones might be driving some of their symptoms that they have, right? So again, I do think that this type of awareness doesn't apply just to, patients, but also needs to apply to doctors as well. So we can recognize when it's appropriate to refer them for someone for additional testing. And it's one of those things where I think, Hone is trying to do a better job of getting that word out there to both to people, to patients, and to the medical community.
It's a big societal shift that has to happen. And that's why I was so excited to speak to you on this, because it's not about, take TRT and get huge and jacked. Like, that fine. But that's not the coolest part of it. It's like, how can we just improve the lives of everybody by this, possibly? And that's really the most beautiful part. Stories like the one that you just mentioned and countless others I can only imagine. So, one step at a time, conversations like this, I think it will, continue to get out there and become more accepted and more just widely known and talked about within the medical profession and just within friend groups. And, step by step, we'll start to help more people. Jack, is there anything else that you wanted to discuss with me today before we wrap it up? I don't want to take up too much more of your time.
No, it's been a great conversation. I think you're doing a really great service here, getting the word out. I think I encourage anyone who wants to learn more about it. So Hone actually has a really robust content section where we have a great team of writers and editors who work on different pieces related to not just to testosterone and hormonal health, but also to aspects of just healthy lifestyle, nutrition and different type of exercise. And, I think is for anyone who's interested in learning more, coming to our website and visiting our content section, there's just a ton of great information there. Some of them that I help, write or, review or edit. But a lot of it is just really, really great content that's put together by our team. That's really, targeted towards men who are, sort of in this phase of life that are really trying to make, trying to improve their health and their wellness and well-being. And obviously, your hormonal health is part of it, but it's just a small part of it, right? So that's why I think our content section is really great, because they try to cover all aspects of trying to get to that optimal, lifestyle and health status. But yeah, thanks for having me, Dan. It was really great chatting with you, and hope this is helpful for people that are listening.
Yes, I'm sure it will be, and I appreciate you as well, Jack. I will put the link to Hone in the description of this. The content page, was it called The Edge? I was looking at it just before, but I closed the tab and I don't have it open. It's called The Edge, right?
That's right.
Okay, so I'll put the link to that in the show notes here as well. Jack, are you active on social media at all? Do you want people to reach out to you or just through the Hone channels?
I have a Twitter, but I'm not the most active person on there. But there's probably maybe there's a good reason to get more active on there after all the news Twitter's made recently.
Yeah.
But yeah, I am on Twitter at Jack Jeng. You can also find me on LinkedIn. You can just search for Jack Jeng as well. And I think those are kind of my two socials that I'm most active on.
Okay, perfect. I'll put all of that in the show notes. Everyone can refer back. But this is definitely an episode that I think people should listen to carefully, and please share this one with all of your male friends and your female friends as well for their male counterparts, because this is just a conversation that needs to be out there, and we need to be comfortable having these conversations because of all the trickle down positive health benefits that are going to come with it. So check out Hormone Health. Again, links all in the show notes. Jack Jeng on Twitter and LinkedIn. Jack, thank you so much for being here. Thank you so much, everybody, for listening. Subscribe to the podcast on iTunes, YouTube, Spotify, all the places. Thumbs up, 5-star rating, whatever, all those things. At Daniel Yoris on Instagram as well. And that's it. Go to the gym. Be a good person. We'll chat soon.